Hello everyone, this is Archita and welcome back to my channel Pharmacopedia. Hope you all are doing well. Yes, I'm shooting video after a long time. Sorry for that. But in today's lecture, we are going to discuss about the scalp and its related anatomy. So the contents which we'll be covering is the extent, layers, nerve supply, arterial supply, venous drainage, lymphatic drainage, and the applied anatomy. So the important thing which is asked is the layers of the scalp, which is it is very much important when we are talking about the scalp. So I assure you that at the end of the lecture, you will be able to answer everything regarding the scalp. But you just need to do one thing. You just need to pay attention throughout the lecture. Yes, dear students, moving ahead towards the topic. So, what is scalp? Scalp क्या है? So, scalp is basically the soft tissues that covers the vault of the skull. Skull की vault को जो भी soft tissues cover up करती हैं, that is known as the scalp. Now, talking about the extent. So, anteriorly, this scalp is formed by the eyebrows or the superciliary arch. Posteriorly, it is formed by the superior nostril lines, and laterally, it is formed by the superior temporal lines. So, this comprises of the extent of the scalp. Now, talking about the layers of the scalp. स्कैल्प पे फुल क्वेश्चन भी आते हैं यूनिवर्सिटी एग्जाम्स में अदरवाइज स्पेसिफिकली द लेयर्स ऑफ द स्कैल्प इज बीइंग आस्क्ड so it is very much important for you guys to know. So from superficial to the deep, this scalp consists of total 5 layers as the name suggests. Scalp, S stands for the skin, C stands for the connective tissue or the superficial fascia, A stands for the epineurosis formed by the occipitofrontalis muscle, L stands for the loose areolar tissue and the P stands for the pericranium. Okay, so with the help of this diagram, you'll be able to know the layers of the scalp. So the first layer is formed by the skin. So skin is thick and hair bearing except that of the forehead, and it contains various sebaceous gland or the oil secreting gland, you can say, dear students. So it is one of the most common site of the sebaceous cyst. Okay, so here comes the clinical anatomy or the applied aspect regarding the first layer of the scalp. That due to the presence of the maximum number of sebaceous gland in the skin, it is one of the most common site of the sebaceous cyst. The second layer is formed by the connective tissue. So it contains various arteries, veins, and the nerves, and this contains the dense fibrous network which connects the skin to the epineuritic layer. जो थर्ड लेयर है वो है एपिनेरोटिक लेयर. इट इज फॉर्म बाय द occipitofrontalis muscle, occipitofrontalis muscle. It has two bellies. Okay, so it has two bellies. I'm writing it over here. This is the occipitofrontalis muscle, and it consists of two bellies. The first one is the occipital belly, or and the second one is the frontal belly. So two frontal bellies and two occipital bellies are present, which we'll be seeing later on. And so this epineuritic layer is formed by the occipitofrontalis muscle, and the fourth layer is formed by the loose areolar tissue, and it is of great significance because it has been traversed by the emissary vein. It has been, you can see over here, this is the emissary vein. It has been traversed by the emissary vein, and this emissary vein, what it does is, dear students, it connects the second layer, which connects the second layer of the scalp, which is formed by the connective tissue, to the intracranial dural venous sinuses. Okay, so this emissary vein connects the second layer to the intracranial dural venous sinus. It is very much important. Please remember this, dear student. And yes, the fifth layer is formed by the pericranium. Periosteum covers the outer layer of the scalp, but at the suture. Okay, at the suture, ये जो pericranium है, it is attached to the sutural membrane, which in turn attaches it to the endocranium, and therefore this pericranium also lines the inner surface of the skull as well. Okay, now you need to know that this is the emissary vein. So emissary vein is of two types. The first one is the parietal emissary vein, and the second one is the mastoid emissary vein. Okay, So what does this parietal MSR vein do? It passes through the parietal foramen. It passes through the parietal foramen and it communicates with the sagittal sinus. So this parietal MSR vein passes through the parietal foramen and it communicates with the sagittal sinus, and this mastoid MSR vein passes through the mastoid foramen and it communicates with the sigmoid sinus. Okay, so this was about the MSR vein. नाउ टॉकिंग अबाउट द डिप्लॉय, व्हाट इज दिस डिप्लॉय? ठीक है, तो डिप्लॉय क्या है? यू ऑल नो डियर स्टूडेंट्स कि जो स्कल है इट इज फॉर्म्ड बाय द आउटर एंड द इनर लेयर ऑफ द कॉम्पैक्ट बोन. ठीक है, द स्कल इज फॉर्म्ड बाय द आउटर एंड इनर लेयर ऑफ द कॉम्पैक्ट बोन, नो डाउट. So along with this there is an intervening spongy layer. So this spongy bone is known as the diploid. So how can you define this diploid? You can simply say that the bones of the scalp that consist of the outer and the inner layer of the compact bone with an intervening layer of the spongy bone is known as diploid. ठीक है, जो skull है it is formed by the compact bone, उसके साथ में क्या है spongy bone भी present होती है, that is known as the diploid. And this is being traversed by the diploic vein. So diploic vein is of four types, that is the frontal diploic vein, the second is the anterior and posterior temporal vein, and the fourth one is the occipital diploic vein. So whenever there comes the question, name the types of the diploic vein. So diploic vein is being formed by the frontal diploic vein, the anterior and the posterior temporal diploic vein, and the occipital diploic vein. Okay, dear students, so this was the layers of the scalp, and this is the superior sagittal sinus, and this is the falx cerebri. Falx cerebri is the foldings of the dura mater. So this figure actually makes you more clear about the layers of the scalp. So here the hair is, you can see that the hair is present in the first layer of the scalp, that is the skin, and यहाँ पे the MSR vein. So this MSR vein connects the second layer to the intracranial dural sinuses, and yes, the when I talk about the intracranial dural venous साइनस, तो ये बहुत ही इंपॉर्टेंट है, इस पे अलग से भी क्वेश्चंस आ सकते हैं. तो जस्ट फॉर द नॉलेज, और यू कैन स्किप ऑल्सो, दिस इंट्राक्रेनियल ड्यूरल वेनस साइनस इज फॉर्म्ड बाय टू वेज. फर्स्ट वन इज ड्यू बाय द सेपरेशन ऑफ the two layers of the cranial dura. cranial dura के दोनों layers के separation की वजह से ये form हो सकते हैं, या तो फिर reduplication of the meningeal layer. ठीक है, this is just for your knowledge dear students, if you want you can just skip it out as well, but I'll be explaining it here कि ये जो intracranial dural venous sinus है ये किस किस चीज से बना है. It is formed by the separation of the of the two layers of the cranial dura, and also it can be formed by the reduplication of the meningeal layers. And this intracranial dural venous sinus is present between the endosteal layer of the dura mater and the meningeal layer of the dura mater. The features of this sinus is that it lies between the layers of the dura mater. No muscles is present in its wall, and it is being lined by the endothelium. And this intracranial dural venous sinus is classified into the unpaired and the paired sinuses. So this unpaired and the paired sinus is of great significance. For example, within the unpaired we have the superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus. And when I'm talking about the paired sinus, so it is formed by the one of the most, that is cavernosus sinus, superior petrosus sinus, inferior petrosus sinus, and so on. Okay, so this was just an introductory portion regarding the intracranial dural venous sinus. Now talking about the occipitofrontalis muscle, so it is, as I've told you, that it is formed by the occipital belly and the frontal belly origin. The occipital belly is takes origin from the highest nuchal line of the occipital bone, and जो frontal belly है वो आपकी skin और superficial fascia of the eyebrow से origin लेती है. and it is inserted into the epicranial epineurosis. Yes, dear students, जो epineurotic layer है, it is also known as epicranial epineurosis or the gallia epineurotica. तो अगर आपसे पूछे कोई कि एपिन्यूरोटिक लेयर को और क्या बोलते हैं, सो इट इज आल्सो नोन एज द एपिक्रेनियल एपिन्यूरोसिस और द गैलिया एपिन्यूरोटिका. Nerve supply. So this occipitofrontalis muscle is supplied by the facial nerve, which is the seventh cranial nerve, and the action is that it moves the scalp over the skull, and also it helps in raising the eyebrows. So you can see here, this is the occipitofrontalis muscle having the two frontal bellies and the two occipital bellies and the aponeurosis between them. Now coming to the nerve supply. So nerve supply contains the sensory supply. इसके अंदर आते sensory supply and the motor supply. ठीक है? तो अगर हम सेंसरी सप्लाई की बात करेंगे, सपोज दिस इज द स्कल एंड दिस इज द मिड लाइन. ओके, सो मिड लाइन के दोनों साइड के, लाइक ऑन ईच साइड ऑफ द मिड लाइन, इट इज सप्लाइड बाय द 8 सेंसरी नर्व्स. जो स्कैल्प है ये 8 सेंसरी नर्व से सप्लाई होती है. 4 इन फ्रंट ऑफ द ऑरिकल. इन फ्रंट ऑफ द ऑरिकल आपकी 4 nerve hai, and behind the auricle also it is formed by the 4 sensory nerves. Okay, so the nerves which is present in front of the auricle is derived from the trigeminal nerve or the fifth cranial nerve, or the fifth cranial, which is the largest cranial nerve, and behind the auricle it is derived from the second or the third cranial nerve. डियर स्टूडेंट्स, वाइवा में ये क्वेश्चंस बहुत ही ज़्यादा पूछे जाते हैं डेरिवेशन की, कोई भी नर्व्स किससे डेराइव की जाती हैं. ठीक है, तो यहाँ पे क्या है, जो भी नर्व्स आपकी ऑरिकल के एंटीरियर लाई करते हैं और इन फ्रंट ऑफ द ऑरिकल है, वो ट्राइजेमिनल नर्व से डिराइव्ड है, और जो बिहाइंड द ऑरिकल है, इट इज डिराइव्ड फ्रॉम द सेकंड और द थर्ड सर्वाइकल नर्व्स. सो हियर यू कैन सी हियर द फर्स्ट वन इज द supratrochlear nerve, the second one is the supraorbital nerve. So the first one, that is supratrochlear nerve, it is formed by the ophthalmic division of the trigeminal nerve. Second, supraorbital is also formed by the ophthalmic division of the trigeminal nerve. The zygomatic temporal and the auriculotemporal is also derived from the trigeminal nerve. The behind the auricle, the great auricular, lesser occipital, greater occipital, and the third occipital is derived from the cervical nerves, and the first two is derived from the ventral ramus of the cervical nerve, and the greater occipital and the third occipital is derived from the dorsal ramus of the cervical nerves. Okay, so here you can see here that this zygomaticotemporal is a branch of the zygomatic nerve, which is the maxillary division of the trigeminal nerve, and the auriculotemporal is a branch of the mandibular division of the trigeminal nerve. Now talking about the motor supply. So motor supply में आते हैं आपके दो nerves, one in front of the ear, that is the temporal branch of the facial nerve, which supplies the frontal belly. जो आपकी occipitofrontalis muscle की frontal belly को supply करती है, वो है temporal branch of the facial nerve, and जो behind the ear supply करती है, this is the posterior auricular branch of the facial nerve, supplying the occipital belly of the occipitofrontalis muscle. Talking about the arterial supply. So scalp has very rich blood supply. So again, midline की each side में क्या है, it is supplied by the 5 arteries, 3 in front of the auricle and 2 behind the auricle. The 3, that is the superior supratrochlear, supraorbital, and the superficial temporal artery is in front of the auricle, and the posterior auricular and the occipital artery is behind the auricle. Here is the temporal flap. So what is it actually? इसका जो clinical significance में आता है, it is the reconstruction of any sort of craniofacial defects. Okay, so this temporal flap is used in the reconstruction of any sort of craniofacial defects. Okay. Okay, dear students. So one more thing is that कि ये जो arteries हैं, ये क्या करते हैं, ये आपस में तो anastomose करते ही हैं, but on each side it also anastomoses with the arteries of the other side. You can see here over here. So it is one of the most common site of collateral circulation. ठीक है, तो यहाँ पे एक बहुत important question आपके पास में आती है कि ये जो scalp है, इसकी जो arterial supply है, इसमें ग्रेटर सिग्निफिकेंस क्या है, तो उसमें ग्रेटर सिग्निफिकेंस के अंदर आता है कोलेटरल सर्कुलेशन, दैट दिस द आर्टरीज ऑफ द स्कैल्प आल्सो possess the collateral circulation due to the anastomosis between themselves and with the arteries on the other side as well. Okay, so this is simply a diagram showing you the arterial supply and the nerve supply. Now talking about the venous drainage. So on each side it is simply drained by the 5 veins. So इसमें name याद करने में कोई problem नहीं है, because जो names है वो repeatedly repeat हो रहा है. Supratrochlear artery, supratrochlear vein, supraorbital artery, supraorbital vein. Okay, similarly superficial temporal vein, posterior auricular vein and the occipital vein. But before that एक venous drainage है which you need to know कि ये जो वेनस ड्रेनेज ऑफ स्कैल्प है एक्चुअली में ये पूरा कैसे प्रेजेंट होता है, मतलब कि व्हाट आई वांट टू से डियर स्टूडेंट्स कि एग्जैक्ट जो पूरा वेनस ड्रेनेज है स्कैल्प के अंदर, you need to know about this. So firstly what happens is, suppose this is the supratrochlear nerve and this is the supraorbital nerve. So this basically combines to form the angular nerve, angular vein, okay, sorry, angular vein, and then this angular vein drains up into the facial vein. Again there is the superficial temporal vein. Okay, so there is the superficial temporal vein, and here is the maxillary vein. So this drains up into the retromandibular vein, and this has two divisions, that is the anterior division and the posterior division. Okay, anterior division and the posterior division. So anterior division along with the facial vein together drains up into the common facial vein that drains up into the internal jugular vein. So it actually traverses into the neck. Yes. Now as I've already told you कि behind the auricle आपकी क्या है, posterior auricular nerve. So जो posterior auricular nerve है वो क्या form करती है, it along with the posterior division of the retromandibular nerve drains up into the external jugular vein, which ultimately drains up into the subclavian vein, and the occipital vein drains up into the occipital plexus. ठीक है, ये आपको जस्ट एक्सप्लेन करने के लिए मैंने यहाँ पे दिखा दिया है कि एक्चुअली में ये चीज होती कैसी है. फॉर एग्जाम्पल लेट मी टेल यू अगेन, ये क्या है, ये है आपकी सुप्राट्रोक्लियर वेन, ये है आपकी सुप्राऑर्बिटल वेन, एंड दिस टुगेदर ड्रेन्स अप इनटू द एंगुलर वेन. ठीक है, फिर क्या है, देन इट ड्रेन्स अप इनटू द फेशियल वेन. फिर क्या है, यहाँ पे आते सुपरफिशियल टेम्पोरल वेन, यहाँ पे सुपरफिशियल टेम्पोरल वेन, एंड देन देयर इज द मैक्सिलरी वेन दैट ड्रेन्स अप इनटू द रेट्रोमैंडिबुलर वेन. ठीक है, फिर रेट्रोमैंडिबुलर की आपकी दो सब डिविजन्स हैं, द एंटीरियर सब डिविजन एंड द posterior subdivision. जो anterior subdivision है along with the facial vein, it forms the common facial vein that drains up into the internal jugular vein. Here behind the auricle क्या है आपकी posterior auricular vein that along with the posterior division of the retromandibular vein drains up into the external jugular vein, and that ultimately drains up into the subclavian vein. And here it is the occipital. Okay, here is the occipital vein that drains up into the occipital plexus. Okay, so this is the complete venous drainage regarding the scalp. I hope I am able to explain it to you all. Okay, so this is the venous drainage of the head and the neck. So here you can see this is the internal jugular vein. This is the internal jugular vein, and this is the external jugular vein. Okay, this is the external jugular vein, and here is the maxillary vein, and this is the superficial temporal vein that supplies the scalp. This is the superficial temporal vein that supplies the scalp. You can see here, you can spot here that this is the retromandibular vein, and this is the maxillary vein, this is superficial temporal vein, and this is the posterior auricular vein. So with the help of this thing you will be able to actually understand it more clearly. So I have just explained it to you in this way. Okay, talking about the lymphatic drainage. So lymphatic drainage में आते हैं that the anterior part of the scalp and the forehead drains up into the submandibular lymph node. Okay, so it basically drains up into the mandibular lymph node, and the lateral part of the scalp above the ear drains up into the superficial parotid lymph node. Okay, and the third one is that the part of the scalp which is above and behind the ear is drained up into the mastoid nodes, and the vessels which is present in the back of the scalp drains up into the occipital node. तो यहाँ पे जो 4 नोड्स हैं वो आपके लिए इंपॉर्टेंट है, क्या है? सब मैंडिबुलर लिम्फ नोड, सुपरफिशियल पैरोटिड लिम्फ नोड, and the mastoid lymph node, and at last the occipital lymph node. Okay, dear students, so here the lymphatic drainage ends up. Now talking about the applied anatomy of the scalp. The first one, as I've already told you, is sebaceous cyst. The second is the laceration of the scalp, which is very much common. The third is the scalp hemorrhage. The fourth one is any sort of scalp infection. The fifth one is the black eye. When I talk about the black eyes, you can see here, this is the example of the black eye, and this is the sebaceous cyst. So what actually happens is कि क्या होता है कि I have told you कि जो आपकी loose areolar tissue है, ठीक है, which forms the third layer, okay, which forms the third. Let me select the pen. Okay, so क्या है loose areolar tissue. लूज एरियोलर टिश्यू ये क्या फॉर्म करती है? ये आपकी फोर्थ लेयर फॉर्म करती है स्कैल्प की. सो ये जो लूज एरियल टिश्यू है, द ब्लड और द फ्लूइड, ओके. जब भी क्या होता है ब्लैक आई के केस में, क्या होता है कि जब भी कोई वायलेंस का केस होता है या किसी भी तरीके का और ब्लोन होता है ऑन द हेड, व्हेन द हेड इज ब्लोन, तो इन दैट केस क्या होता है कि जो भी ब्लड और फ्लूइड एक्यूमुलेट प्रेजेंट होती है लूज एरियल टिश्यू में, इट टेंड्स टू एक्यूमुलेट, क्योंकि क्या होते हैं बोनी अटैचमेंट्स होते हैं, ड्यू टू द बोनी अटैचमेंट्स और द ऑसिपिटोफ्रंटालिस मसल इन द फ्रंटल एंड द ऑसिपिटल रीजन. तो ऑसिपिटोफ्रंटालिस मसल की बोनी अटैचमेंट्स की वजह से क्या होता है, जो भी ब्लड या फ्लूइड है वो लूज एरियल टिश्यू में कलेक्टेड रहते हैं या प्रेजेंट रहते हैं, और ये क्या करते हैं, ये आगे जाके मूव नहीं कर पाते हैं, एंड देयरफॉर ये क्या करते हैं, इट टेंड्स टू गेट ट्रेवर्स्ड और द पास्ड इनटू द आईलिड्स and forming the black eye or the hematoma. As you can see over here, this is the occipital belly of the occipitofrontalis muscle. This is the eyebrow. Okay, this is the frontal belly. So here this is the loose areolar tissue and the blood in the connective tissue over the orbicularis oculi. तो क्या है, जो भी आपकी ब्लड है या कोई भी आपकी जो भी फ्लूइड्स है, इट टेंड्स टू मूव इनटू द सबक्यूटेनियस लेयर ओवर द orbicularis oculi muscle of the eyelids. Okay, so this ultimately forms the condition known as the black eye. तो ब्लैक आई के केस में सिंपली आई एम एक्सप्लेनिंग टू यू अगेन कि क्या होता है कि लूज एरियोलर टिश्यू में फ्लूइड या जो भी आपकी ब्लड है जो प्रेजेंट है वो ड्यू टू द बोनी अटैचमेंट्स ऑफ द occipitofrontalis muscle वो मूव नहीं कर पाते हैं, therefore it tends to pass into the subcutaneous layer over the orbicularis oculi muscle, that is the in the eyelids, and forming the hematoma or the ultimately to the resulting in the black eye. Okay, talking about the surgical layers of the scalp. So surgical layer of the scalp is formed by the 3 layers of the scalp. Okay, 3 layers of the scalp, that is the skin, connective tissue and the epineuritic layer, together known as the scalp proper. तो फिर क्या होता है कि जब भी ये जो सर्जिकल लेयर है इसमें किसी भी तरीके की इंजरी या व्हेन द लेयर्स आर कॉट इन द मशीनरी, सो ये जो स्कैल्प प्रॉपर है या ये जो तीनों लेयर्स हैं ये क्या है, एवर्स्ड हो जाते हैं, ठीक है, या इंजर्ड हो जाते हैं. तो इसका जो ट्रीटमेंट है वो रीप्लांटेशन ऑफ द एवर्स्ड पार्ट ऑफ द स्कैल्प, द बेस्ट ट्रीटमेंट. सो अगर आपसे कोई पूछे कि स्कैल्प की सर्जिकल लेयर्स क्या है, सो द फर्स्ट 3 layers of the scalp is known as the scalp proper, and it together form the surgical layers of the scalp. Now talking about the dangerous area of the scalp, ये आपकी वाइवा का one of the most important question है, that is the dangerous area of the scalp, not only in the viva but for your university exams also. तो जो भी लेयर है आपकी लूज एरियोलर टिश्यू की, दैट इज नोन एज द डेंजरस एरिया ऑफ द स्कैल्प, बिकॉज क्या होता है कि जो भी ब्लड और पस है, इट टेंड्स टू कलेक्ट इन दिस लेयर. ओके, एज आई ऑलरेडी टोल्ड यू. अब फिर क्या होता है, जब ये जो पस है, ये जो ब्लड है, वो जो कलेक्ट होते हैं, वो क्या है, ये एमिसरी वेन के द्वारा ये इंट्राक्रेनियल ड्यूरल वेनस साइनस में ट्रैवल करता है, विच में लीड्स टू थ्रोम्बोसिस एंड मे बी वेरी फेटल. I have already told you, dear students, कि जो loose aerial tissue it is traversed by the emissary vein that connects the second layer of the scalp with the intercranial dural venous sinuses. Okay, so किसी भी infection के case में क्या होता है कि ये जो emissary veins हैं ये सेकेंड लेयर से क्या करते हैं, इंटरक्रिनल ड्यूरल वेनस साइनसेस में आपके इन्फेक्शंस को या जो भी पस है वो उसके थ्रू स्प्रेड कर सकते हैं, विच लीड्स टू थ्रोम्बोसिस एंड इट मे बी वेरी फैटल. Okay, so this was all about the scalp. So I just hope that I'm able to clear the topic for you guys. And yes, in case of any queries, do let me know in the comment section below. I will be happy to help you. And yes, if you want me to make more such videos, please comment below. And yes, do not forget to like, share and subscribe to Pharmacopedia. And yes, thank you so much for watching this video. मिलते हैं next video में. Till then, keep studying and take care.